Cheers and welcome to Abstract Essay, where ideas take shape, thoughts find depth, and every conversation explores the art of thinking beyond the obvious. And today I have my special guest. She is a patient safety expert, visionary nurse leader, and of course, transformative educator, no other than Miss Julie Siemers. Welcome to Abstract Essay, Miss Julie, and can you please introduce more about yourself that I missed?
Sure. Thank you. Happy to be here. So, I've been a nurse for 46 years. I spent 30 years at the bedside taking care of patients in the ICU, trauma centers, as a flight nurse on the helicopter, and then entered nursing education to try to share what I've learned with new nurse students. And when I started my master's during that same time back in 2009, and then my doctorate, and discovered that patient preventable harm was causing over 250,000 deaths every year. Some estimates say more. And so I dug into that to try to understand because, like I said, I was already a nurse for 30 years. How come I did not know that? Because we don't speak about patient harm. So that prompted my whole journey to take me where I'm at today.
Miss Julie, thank you so much for sharing your knowledge and wisdom to the world. And today, let's talk about how to speak up in the hospital without being dismissed. Tell us, let's start with the core issue in your experience. What does being dismissed in a hospital setting actually look like and feel like?
Yeah. So let's take it to what I think is the core issue, at least here in the United States, is that healthcare has always been a hierarchy. Your doctor knows best. Just listen to your doctor. You don't have any medical training, and he or she does. Same with the nurses. But what we're finding is, especially with the transition in healthcare, that healthcare providers don't have the time to take with you. And so they may miss critical elements of your health. So that's kind of the beginning is that patients and families need to learn to speak up, but more importantly, to understand that it's a two-way conversation. It can't be the patient and family being a passive receiver of healthcare. You need to take an active role in your healthcare to make sure that you prevent harm happening to you or your family member. So it's not in our natures to question a physician or a nurse, but I'm going to say today that we must. We must transform and change that attitude, not to be, um, what's the right word? Not to
Arrogant.
scare anyone. Yes,
Hmm.
exactly. But to know that healthy skepticism is the only way that we're going to remain safe in healthcare, and question things when you're not sure. Question things when you have a gut feeling that something's not right.
Miss Julie, there's an inherent power dynamic between a patient in a gown and a professional in white coat. How can patient begin to level that playing field from the moment they walk in?
The first thing is to become informed and educated, and that will empower you as a patient or family member to say what's on your mind, to speak up, to show the healthcare provider that you have an vested and active interest in your own health. Because one form of treatment or one surgery or one path to go down may not be right for everyone. And so you've got to take your own circumstances and beliefs and health into consideration when you're making those decisions. The problem is if we don't speak up when we feel like something's wrong or that we don't understand, is that harm can occur. For example, here's an easy description of what may happen in the hospital. Medication errors cause 50% of the patient harm. So if the patient and the family ask questions when the nurse comes in the room to say, okay, I've got your blood pressure pill for you. Oh, well, which one is it? Is that the same one I take at home? Is that the same dose? Or whatever those questions may be for you to have a clear understanding. It has been many patients that speak up that actually have a nurse say, oh, let me double check on that. And then sometimes that prevents a mistake.
A mistake for sure. And Miss Julie, it's not just about knowing what to say, but overcoming to fear of being seen as a difficult. How can someone manage that anxiety and advocate for themselves without feeling guilty?
So the three P's: be present. That means be there when nurses do shift change or when the doctors come to visit if you're in the hospital. And I mean, be present in your heart too. Assume good intent, but you also have to be active so you can ask appropriate questions. The second one is be polite. Even when you don't feel like you want to be polite, maybe you're frustrated, maybe you've been waiting 6 hours to see the doctor and you're just frustrated, but always go into a conversation with politeness because we don't know what was going on to prevent in that situation. Maybe the doctor got tied up in an emergency in the emergency department. But the third one is be persistent. So even if a nurse tells you, yeah, that's normal for a patient postoperatively that they look very pale and that they have a higher heart rate, but if you as a family member keep monitoring and watching because you feel something's not right, and then you say, well, now the heart rate's higher, I think someone else needs to assess my dad, um, escalate to the next person in charge. It's called the chain of command in the hospital. So it would be the charge nurse that's next, then the hospital supervisor that's over all of nursing 24 hours a day. And after that, there's an administrator on call.
Escalate, people, that's the word. And questions about preparation and strategy. You advocate for creating a patient one pager. What is the absolute essential information that should be on the single sheet of paper for any hospital visit?
The first thing I would do before you even go to the hospital, and even if you don't have a planned visit, I would do this right now. Go on the website hospitalsafetygrade.org and look up the hospitals in your area. You'd be surprised. They range from A through F, just like your college or high school paper or grades in your courses. And this website, hospitalsafetygrade.org, rates, it's a nonprofit agency, but it rates hospitals on patient safety. And there's five main categories and then there's subcategories. So we know that if you go to a D or F rated hospital, your chances of harm or even death are about 91% higher. So if you've got your option, and even if it's a little further away, I would definitely choose an A or B hospital versus a D or F. So that's the first thing you should do. And dive in. It'll tell you where the gaps in safety are for that hospital. And it easy, just like a traffic light, red, yellow, green. They're doing really well in this category or not so well in this category. For example, infections or postoperative complications. And that gives you information to then talk with your doctor about.
That interesting facts, Miss Julie, and thank you for sharing to the world. And how critical is to have a second person there as an advocate? And what's one piece of advice you give to a person how to do most effective?
I think it's very important to have a person with you, a friend or a loved one, because if you're ill, and most patients that go to the hospital are pretty sick, you may get medications that may, pain medications or sedatives or anti-nausea medications that might not make you as mentally sharp as you want to be. And you might not hear what the doctor or nurse is saying or doing. And that second person in the room I suggest taking a notebook and write things down because communication breakdowns in healthcare are responsible for 70% of patient harm. So that communication breakdown is between, or can be between, doctor to doctor, doctor to nurse, but it also involves the family. So if family members don't speak up and say, my mom is 70 years old, but this is not like her. She's confused and she's normally not. If we don't share that and the healthcare team assumes because this woman is 70 years old that she's confused, that's her normal state, then they're not going to investigate further to find out what the cause is. So take a notebook, make notes. Sally, the nurse, came in the room and gave my mom a blood thinner because you, as a patient or patient advocate, is asking, what medication are you giving to my mom and why? What's this supposed to do and what should we look for? And then, a couple hours later, if someone comes in the room, let's just say it's shift change and it's a new nurse, and you're asking, oh, what are you giving my mom? And this nurse says, the blood thinner. You know that you wrote in your notes that was already done. There's a case of this that happened in California not too long ago where the nurse did not document the first dose of the blood thinner. And the next shift, that nurse saw that it wasn't given, or they assumed it wasn't given, and gave another dose. And this caused a cranial bleed in the patient's head, and they eventually died. So it really is important to keep notes, keep track of things, what certain health providers say or do, and just for your own records.
You suggest writing things down. Should a patient be taking notes openly during consultation, or how does that change the interaction?
I would definitely say yes, because you're not going to remember things. When the medical team use medical jargon and we don't understand as patients what that means, that can leave us really confused. So, for example, if a doctor comes in and says, Mr. Smith, your wife has congestive heart failure, we're going to get an echocardiogram and we're going to start her on a diuretic. It is your right as a patient to say, what does that mean? Please tell me that in layman's terms so that we can make decisions and know what to watch for and understand. And if you, like I said, you don't write it down, you may forget.
Yes, for sure. So, Miss Julie, can you walk us through your BEEP method? Brief evidence, empathy, and partnership, and give us an example how it works in real scenario.
Yeah, I think that one thing I teach also is the cuss words that goes right along with this in communication. And so the C stands for concerned, U, uncomfortable, S, scared, and the second S, I believe we have a safety issue. And so when we use those words, I'm really concerned that my dad's breathing is worse than it was a few hours ago. That terminology really helps us focus in on what is wrong or what we think is wrong and what we're asking the healthcare team to do. Can you please come assess him again? The empathy part of it is absolutely so essential because compassion really is the foundation of healthcare. We're, we that work in the healthcare field have been trained with um, knowledge to understand the physiology of the body, medications, surgeries, and the layperson doesn't. And so when we try to help that person come through their health crisis, whatever it may be, it really takes empathy to understand what they're going through and to put ourselves in their shoes. How would we like to be treated if we were laying in that bed? And sometimes we forget that.
Miss Julie, what are the respectful but firm way to ask a doctor or nurse to explain something again if you don't understand the jargon or the treatment plan?
The best way, I think, is to come from a perspective of curiosity. So if you say, can you help me understand what congestive heart failure is? What does that mean? What is the prognosis for that? How do we treat it? What could we do as family members to help our mom or dad?
Hmm. Yes, definitely. Ask people if you don't understand. And Miss Julie, as a patient safety expert, visionary nurse leader, and transformative educator, what are your short term and long term goals?
My goals is to get this message out to as many people as I can, which is why I did my TEDx talk in January talking about this. My favorite topic, which is how to communicate safely to keep patients safe, tips and cues for both, clues for both, healthcare teams and family members. What I'm working on now, I'm really excited about, is I'm developing an app for patients and their families where I've got a free course on what is patient safety, and what are the major things that we should watch for going into a hospital. And then I have more courses they can take for people that want to dive in a little bit deeper. So I wrote my book 2 years ago, Surviving Your Hospital Stay. And this is kind of an extension of that and makes it a little easier to be mobile on your phones on an app that you can just look up and say, what did she say about going to the hospital? Where's that website that I need to look up and see how safe my hospital is? Or what are normal vital signs? Or how do I have crucial conversations with the healthcare provider? Because I'm scared, I'm timid. And so I've got a lot of that in there too.
Well, good luck to your goals, Miss Julie, and looking forward for more success. And what would be your piece of advice for those people out there who want to be like you?
I think that we all can make a change. I love the quote, be the change you want to see. I thought about this for a long time and I wondered why somebody wasn't doing this, like helping patients get educated on the really important things to stay safe. And so when nobody stepped up that I could see that was doing it, I said, well, I have all this education, I have all this experience. I researched the topic because I'm so passionate about it. So I guess that'll be me to be the spokesperson to really help patients and their families.
Thank you for that advice, Miss Julie. And are there specific powerful phrases or ways of framing a concern that are more likely to be heard and taken seriously by busy medical staff?
Yeah, I think using the cuss words for sure. I'm concerned. And this just means you need to be observing what's going on and again, be informed in what's normal and not normal, especially maybe after your son is having surgery and knowing that one of the things we're going to look for, let's just say it was a knee surgery, we're going to make sure that that knee gets blood flow, what we call perfusion. So it's those things that is really going to help you as a family member. And then when the nurse comes in the room, you can say, I'm really concerned. His foot is cooler than the other foot, and it's a little bit paler in color. Can you please assess that for me again? And knowing that you have that concern, and those are very valid points to make, and you speak up, and you always do it with politeness, and you do it from a perspective that you want to be helpful. And I think when we come from it from that angle, yes, you're still going to have healthcare providers that get a little defensive. We can't change that. I'm trying to change it from the nursing education perspective, is that value your patient's family members and loved ones as extensions of the care team. They really are a safety net. And if we can get the healthcare team to understand they're not there to make trouble and complain, but they're just concerned. And when we treat them with respect, both ways, then I think we're really going to see a difference.
Beyond a notebook, are there apps or digital tools you recommend for keeping track of symptoms, questions, or medical history on the fly?
Yeah, I think making a notebook, there's probably apps out there to keep, journals of your data. Let's just say it's your blood sugars or it's your blood pressures. Those are really good things to keep track of, especially if you've got concerns. Then when you go in to see the doctor, if you're not going to the hospital, but you go to the doctor's office, you can take that data, and it's very clear. Your blood pressure was X on this day, and then the next day it was this. And those documented trends can really help the doctor see what your concern is and therefore take it seriously and come up with a solution. Doctors, unfortunately, here in the United States have a short window to see patients in the office, and they may not get the full picture. And so, if we can give them as much pertinent or important information when we first come in there, it can help you get the best care you can.
The best care for sure. And Miss Julie, what is the most common well-intentioned mistake people make when they are trying to advocate for themselves that actually cause them to be dismissed?
I think not speaking up is the biggest problem. And I know a lot of patients and families say, well, my doctor went to medical school for 12 years. That nurse went to school for 2 or 4 or 6 years. What do I know? Well, you actually do know a lot. And so again, positioning how you speak as trying to be a partner, and look things up. I mean, we're so fortunate that we live in a time where we can get access to information. We can get access to research studies. Some of them might not be as easy to discern, but I always recommend using AI, artificial intelligence, because yes, there are some challenges that you might get a little bit of misinformation here or there, but overall, artificial intelligence has been so helpful in just putting in a set of symptoms, or a question. Should I be concerned? Let's just say my gums are bleeding when I brush my teeth. My doctor put me on a blood thinner, for my heart dysrhythmia. Should I be concerned? um, and writing those things down and keeping track of them and understanding when something is important to investigate further, or no, that's a normal symptom of this medication. Or for example, iron, to boost the blood count in your red blood cells. The side effect of that is that stools can become black, and that concerns a lot of people, but that's normal on iron. So just ask those questions to discern, is this something to be concerned about or not, and then go further with it.
Yes, go further, investigate people. And Miss Julie, before we wrap up our discussion for today, I'm inviting you to please do listen to my other podcast, people. My other podcast, because my abstract essay is already in fifth season, abstract poetry in second season, and my book 101 review in fifth season too. Comedy 101 in second season, and my food 101 in fifth season as well. Geography 101 in fourth season, and my baby podcast Law 101 and Mental Health 101 Love Letters in third season, and Movie 101 Review and Music 101 in fourth season, and Science 101 and Sex 101 in its first season. Please listen to them wherever you listen your podcast. So Miss Julie, to end an awful or heartful note, can you share a story of a time when speaking up clearly and effectively made a critical difference in someone's health outcome?
Yes, for sure. We had a patient who had an anterior cervical neck surgery, and he was 74 years old. He lived in a nursing home. After his surgery, he was confused and trying to get out of bed. And the nurses just thought that that was his usual state, mental status. When his daughter arrived and visited, she says, no, this is not like my dad. Something's wrong, and I'm really concerned. And so, what we found with further investigation was that he actually was bleeding on the inside of the throat where the surgery was done. We didn't see it on the outside, but there was a clot forming there, which was blocking the oxygen to his lungs and brain. And so when we discovered that was the problem, so low oxygen can cause confusion. And with the nurses listening to her, and calling the doctor instead of sometimes the typical would be just give the patient some sedation to calm them down, then we could find the real and did find the real problem with this patient. And so listening to her and her raising her concern really had the impact of a good patient outcome instead of what could have been a bad outcome.
Miss Julie Siemers, thank you so much for sharing your knowledge and wisdom to the world. So, can you please invite our listeners to support your advocacy, your business, or whatever projects that you're doing right now?
Sure. All my social media, TikTok and Instagram and Facebook is Dr. Julie Siemers, and my website, drjuliesiemers.com. And that's where you'll see when the app is available, hopefully in a few weeks, where you can download it and learn more information to help you stay safe in the hospital.
Yes, people, let's support Miss Julie Simmers because if you support her, for sure, more and more empowering advocacy to come, more and more empowering tips to come. So, Miss Julie, thank you so much for your time.
Thank you.
More to come, people. See you soon.